If you are trying or have tried to lose weight, you've heard about all those drugs out there to help you, but which ones really work and are safe? National weight loss doctor Scott Massey is here to explain and talk about the science and what you need to know about GLP-1 weight loss medication. So welcome to the show.
Well, thank you for having me.
Yeah, this is such a big topic right now. So tell me a little bit about you and how you got into this line of work, I guess.
Sure. So I'm a board certified internal medicine doctor, been practicing about 13 years. Initially, I did more work with pain management and primary care. In that, you do some weight loss, and then almost 3 years ago, I became a patient myself, and I was very, very surprised about the success I was getting, and I wanted to share that with other patients. So I've shifted towards almost 100% weight loss now.
Yeah, well, tell me a little bit more about your weight loss journey.
Sure, that's a great question. So I'm 58 years old. I've struggled with my weight since college, 40 years. And this is literally the first time I feel like I have some control in my life. I'm down over 60 pounds and I feel great. And it's been a lot of fun, both professionally and personally.
Yeah, well, let's talk about GLP-1s. It's a term that we have all heard by now, but what is it exactly and how does it work?
Sure. So GLP-1s are a family of medicines. They've been around about 20 years. There's probably a half a dozen, but the two most popular ones are semaglutide, which is the generic for Ozempic and Wegovy. And we also have tirzepatide, which is the generic for Mounjaro and Zepbound. And these medicines work on a particular receptor called the GLP-1 receptor. We find those in our brain, stomach, and pancreas. And the way they work is in the brain, they tell your brain you're not hungry. In the stomach, they tell your brain you should slow down on how much you're eating. And in the pancreas, it makes a little bit of extra insulin, which cranks up your body's metabolism, so you're actually burning more energy even at rest.
Yeah. So, how do you feel about these drugs like Ozempic, and who's a good candidate for that?
Yeah, well, so I feel that this is probably the first time where we have good treatment for obesity and weight loss. The previous medicines we had, things like phentermine, topiramate, naltrexone, bupropion, and orlistat, they helped marginally at best.
Yeah. So if someone is interested, how can they get started? What's the easiest way?
Easiest way is to go to our website. It's mymedicalweightloss.com. You can schedule a no cost, no obligation medical consult. We do have video or telemedicine visits available. It seems like a lot of people like that. Everybody's busy schedule.
Yeah.
But that's it. That's all it takes to get started.
Well, I know that these drugs can be expensive. I hear about the cost quite a bit. So, what advice do you have for people who may be worried about the cost? Does insurance cover it sometimes?
No, excellent question. So insurance does cover for some people. It seems like it's getting harder and harder.
Yeah.
And that's for the name brands that we mentioned. But for those whose insurance doesn't cover, there is another option. We do work with some compounding pharmacies. They're a specialty pharmacy that makes the generic.
Okay.
Same exact medicine, but in the generic form. Cost-wise, it ultimately depends on which medicine we pick and your dose. But typically, patients might spend somewhere between $30 to $70 a week to be on our program.
Wow. Okay. So something that people need to think about before they get on this drug.
Yes, ma'am.
I want to ask you about, there's so many ads that pop up on Facebook, on Instagram, talking about how you just call this number and you can get on these drugs.
Sure.
How do you feel about those?
Well, I do have a word of caution. Anybody that is taking any prescription drug, for that matter, really should be under a medical doctor or other healthcare provider supervision. I've heard some horror stories about maybe ordering some things online. You don't know what you're getting. Also, if you're going to be using a compounding pharmacy, they're not all the same either. Okay. I only work with, they're called PCAB accredited pharmacy. Pharmacy Compounding Accreditation Board, but very difficult to get this. Less than 7% of the compounding pharmacies ever get this, and that ensures the highest level quality control standards, purity standards, and also service too.
Yeah.
So.
Well, great, and I know that people can reach out to you and talk to you about this,
yes,
right?
Yes, ma'am.
Yeah.
Yep,
okay.
Anytime. Happy to.
All right. Well, thank you so much for coming on our show and telling us about this. Thank you very much, Doctor. To learn more about what we talked about and to get in touch with Dr. Massey, just head to mymedicalweightloss.com.